Welcome back to CTV Morning Live. As you know, we've been mentioning throughout the course of the day is the big radiothon for the Elizabeth Bruyere Continuing Care and their programs that are happening there. It'll continue on here in the building until 9, and then they're going to be doing it live from Bayshore Shopping Centre right through until 7 o'clock tonight. Joining us is their Chief of Staff, Dr. Pam Eisner. Great to have you on the show.
Thank you. It's nice to be here.
And you know, we're talking about so many of these programs and what is happening with our aging population, and a lot of them needing to make trips into the hospital, but really a lot of this emphasis is on education and programs to help keep them out.
Absolutely.
Is that right?
With the changing demographics we have, more people are aging. We know that we're going to have more and more demand on our healthcare system. What we really need to do is keep people well and keep seniors at home and in the community as opposed to needing placement or hospitalization. So we've got to really focus on keeping people well and at home.
We're looking at education then, but also for the caregivers or for some of their family members. It seems like right now we're talking a lot about the sandwich generation too, right? Which are people, the boomers that are aging, but then are also taking care of their elderly parents and then could have young kids at home as well. So
that's right.
There's a lot on the go.
There's a lot on the go, and that group of people needs to look after themselves in order to be able to care for that younger generation and for their parents. So staying well is really important if you're a caregiver, and that involves making sure that you have your own social networks and that you're getting the supports you need from that network. It also means that you need to be physically active and that you need to keep your brain active yourself. And those are the same tips for frail seniors to stay well.
Let's talk a little bit about that, because that is where the emphasis, we want that to be on, so that they're not having to take the trips into the hospital.
That's right. So, I mean, I think if we were really successful at generating some good health system change, there would be far fewer seniors showing up in the emergency room in the first place. What we want to be able to do is identify seniors who are at risk and who are starting to have difficulty managing early on in that process, and get some interventions in place then that can prevent them from having the fall that results in a fracture, that results in hospitalization, that may result in a placement in a long-term care facility. We want to get the changes made to their care plans and get them strong and well before that fall happens. What
would the care plan entail? Because likely some of it would be safety measures within the home. Some of it might be changes to their physical therapy. Can you give us a list of what that plan might be like?
So the best way of having that really sorted out is to have a whole group of health care professionals who work as a team, look at all the different aspects of that patient's needs. So there's a physician and a pharmacist who will review the medical issues and look at all of the medications. We know that medications can have a big impact on how well someone's functioning. And then a physiotherapist who will look at walking and gait patterns and the risk of falls. And an occupational therapist who will be able to look at the home environment to see what risks are there at home. Are there throw rugs? Are there steps that they can't manage? Do they need bars in their bathrooms to prevent a fall in the shower? Can they look at how they function in the kitchen? So that whole picture of how a senior functions at home, optimizing every one of those elements is what's going to keep them at home.
It would be wonderful to be able to optimize it, but that's going to cost money and funding, and that's where we're at today. Is that right?
Exactly. So our geriatric day hospital does just what I've described, and has recently had an expansion in the number of spaces it has, and the next step is to renovate that environment to make it more friendly and safer for patients. So that's where that's heading. But we know that we also need to be able to expand the principles I've talked about with respect to assessing frail seniors into the community. Not everybody can come into our day hospital. So how can we take our services out? So that's going to be the next step in our development, is providing education to other healthcare providers around how they can do it and where they can come to us when they need some help.
I think you have a lot of people right now trying to figure out, how am I going to be able to get this health plan and this plan into place? So where can people go for more information if they realize now that this is something that they need to get on board, and this is around the timing that they should be doing this?
So our main switchboard number is 613-562-6262, and by calling that number you can access all kinds of our programs and supports. One of the easiest ways to get into the system actually is through the geriatric assessment team, which is, there's one located at Bruyere and there's one located at the Queensway Carleton. They can navigate for you where the most appropriate place is for your senior to get services, or you can also call our day hospital through the same main switchboard number.
It's amazing the work that you're doing, and I know it's just getting, it's busier and busier right now, especially as we're seeing this new generation. So if you can, please help out today. The radiothon will be going right through until 7 o'clock today on CFRA, and we'll be continuing to bring you coverage throughout the course of the day. Pleasure to meet you. Thank you.
Thank you.
We're going to take a short commercial break. We are approaching the top of the hour. A lot of you are waiting for that, which is the time we're going to be doing our Seat in the Heat, the call out to 5 people, hoping one of you calls us back. It has to be the first one to do so, to earn your seat for our big show on November 4th, when we're giving away 6 trips to Cuba. That's coming your way right after this.